Welcome back. In case you have been with us, we really appreciate your time and company. But if you're joining us now, you're just in time for the second part of the program. This is the health and lifestyle segment. Every Wednesday, we get to talk about matters well-being, from diseases to actually things that we can do to prevent diseases. And we are glad that you created time for this one, because this is going to touch on something that will save you a lot of money and also will help you be, healthier and better. And we are going to be talking about the state of nutrition in our country, efforts that can be put in place to ensure that we have access to nutritious food. And I'll be telling you a bit about some initiatives that have been put in place to be able to ensure that each and every person, including those who are in the farthest part of this country, access a balanced diet. I'm having this conversation in studio with me this morning with Ruth Okoa. Ruth is the country director of the Global Alliance for Improved Nutrition right here in Kenya. Karibu sana.
Thank you very much
to the program. Yes. We are glad to have you. She has over 20 years experience in different development fields ranging from agriculture, talk about food security, education, water, sanitation. I'll summarize it generally to mean anything that means you being an overall, individual and your well-being, of course. And she has also held various leadership positions in various organizations, both locally and internationally. And I cannot speak about her, and she's right here. So let's begin by, giving you a bit of a chance, Ruth, to tell us a bit more about yourself and your passion, especially for what you want to discuss this morning.
Yeah, thank you very much, Sarafin. Yes, my name is Ruth Okoa. I currently serve to the Global Alliance for Improved Nutrition as a country director, mostly known as GAIN. I am a demographer by training, so moving from demography, which is almost statistics, to matters agriculture and nutrition is a calling that I have, and looking at the nutritional situation and the suffering of the people in the country is what really drives me to look at how can we support our communities to have healthier diets, better nutrition, and how can we do that in a more concerted effort. Mm-hmm. Yes.
All right. So that is why you're here. By the end of this conversation, I believe we will have a clear understanding of what each and every one of us needs to do, not just the government, but individually. What can we be able to do to ensure that we improve the state of nutrition in our country? So I was just looking at some numbers. Allow me to run our viewers through this before we begin our conversation. If you want to understand why this is a very important conversation, I was looking at a report by the Ministry of Health. This is under the Division of Family Wellness, Nutrition and Dietetics. And they're saying that as of July 2024, 760,000, this is over 760,000 children aged between 6 to 59 months, they require management for acute malnutrition. And this report shows that this is a slight improvement from what was recorded in February 2024. That is 847,000 children aged between 6 to 59 months. We are also seeming to be doing well, because if you look at what this division reported in July 2023, it was slightly above 945,000 children who are in need of management for acute malnutrition. So there seems to be progress. But this number, Ruth, 760 is still too high. So my very first question would be, why is malnutrition still a problem in our country? Why is it still a burden in our country?
Thank you very much, Sarafin, for the question. And probably just to add to your statistics, we are looking at this year, but if you look over time, we've still had very high rates of stunting. Averagely, as a country, we have an average stunting rate of 18%. We have an average wasting rate of 5%, and underweight children of 10%. These are human beings. If you convert this is children, this is for children under 5 years. And it is very sad that in a country where we are one of the, moving towards the middle-level development countries, we are still experiencing issues of malnutrition. So a lot needs to be done. And we are experiencing this because one of the things is we've seen a lot of climate change issues in the country, and therefore this has affected food production. Even in counties where there is adequate food production, they don't diversify their production You know, a county like Nyandarua is known to be a food basket, but they produce certain crops only, and they don't diversify. And the other thing is they don't eat that food enough, sufficient enough, to be able to get better nutrition for them. And if you look at the overall burden of malnutrition in this country, you know, by 2019, you know, cost of hunger study, the government had spent 374 billion Kenya shillings for nutrition rehabilitation. What we are talking about now, we are talking about 760,000 children.
Yeah.
But if you look at how much will be required for nutrition rehabilitation, it's absolutely huge amount of money to bring these children to what they should be. And then you look at the long-term effect. There are issues related to child's performance. You know, this is when we see cases of retarded growth. This is the point we see absenteeism from school. This is where we see school incompletion and repetition of classes. So we are still in this state as a country. One, our food systems still are not at a level that are able to produce enough food to take care of this population. Number two, our supply chain system is largely inefficient. You know, the supply chain is mainly the private sector. Have we capacitated the private sector to be able to be in the value chain, doing transportation, food processing, aggregation? The answer is no. And when you go back, we've made a certain commitments, even at the regional level. I'm glad that Kenya was a signatory to the Malabo Declaration of 2014, in which we committed to increase the agricultural budget to 10%.
Have we done that?
We have not done that. We have not done that. We are not even near reaching there.
But just as we move on,
yes.
Why do you think this problem has persisted despite the level of effort that we have seen being put in place to address it, even including global commitments that we have made, the budgetary allocations we have put in place to address it? Why is it still a problem?
I think first, Sarafi, let me disagree that first there's no budgetary allocation. It's very minimal. If you take nutrition as a fact, as a concept or as a department, there's very limited budget for nutrition in anywhere, from both at the national level and at the sub-national level. What is budgeted for is nutrition for emergency. We want to see that there's an emergency when you allocate funding.
Or like during drought, during floods.
Exactly. That's where we have money and say, now we need to address these issues. We need to have a systematic approach. We should have a food system transformation approach to dealing with matters malnutrition or dealing with matters nutrition. Second, nutrition is cutting across all sectors: education, health, trade, agriculture. But we have siloed approach to dealing with matters nutrition. Everybody is operating in their own silo. Nobody comes together and say, what can we do collectively for this child who is malnourished and going to school? For this mother who is malnourished and is expectant, what should we do? Everybody looks at themselves in a siloed approach. Until we have a multi-stakeholder, a multi-sectoral approach to issues of nutrition, it becomes a challenge. Number two, if you look at the policies that we have, and I want to say we have one of the best policies. By 2012, Kenya had developed the Food Security and Nutrition Policy, which every year is operationalized in the Kenya Nutrition Action Plan, and at the county level we have the county action plans. But there's no adequate budget for this. There is no monitoring for this, and there often no enough adequate personnel to ensure that these items or these plans activities are actually taken.
So they just look good on paper, but if you go down to where impact is supposed to be felt, we do not see much that is happening when it comes to addressing the nutrition gap.
I think it becomes like good to have. I would call them the statements of good faith that are put in paper, but they don't move beyond beyond those shelves to really full implementation. We also have policies that are not coherent, policies that are clashing, and therefore people or stakeholders are left wondering, which policy do I go by, or what do I do? And then let me also give an example. If you look at nutrition and our health system, most of the people in Kenya, access health at mainly level 2, which are dispensaries. In the communities, this is where we have a majority of Kenya seeking health. But do we have a nutritionist at that point? We don't. We don't. So if there is a child that is malnourished, if there is an expectant mother that has a problem, if there is an adolescent that is iron deficient, what happens? They will continue like that. So unless we also look at the system, where are the majority of the community seeking help in terms of nutrition issues and fix it from there, it becomes difficult to try and fix it from level 6 Kenyatta National Hospital.
That's very true.
Yeah.
Because if you look at who is mostly affected, even with what the numbers are telling us, are the most vulnerable people in the most vulnerable counties, the most vulnerable regions, those who have probably low income. So if you talk about cascading the strategies to those people, then that makes a lot of sense. But I want to understand how you think the government, especially the national and county governments, can change their strategy. What is it that they can be able to do different to address the nutritional gap in the country? Yeah.
Thank you very much. I think the responsibility really squarely falls with the national and the sub-national level, the county governments, in addressing the issues of nutrition. One, as I said earlier, they're very good policies and plan. Let us budget for these policies. Let us budget in terms of personnel and in terms of finances to be able to implement these policies. Number two, we need to do a lot of surveillance on certain aspects of the policy. One of the things is Kenya adopted, through the support of GAIN, mandatory food fortification in 2012. Fortification, not for all the food, but the flour, maize flour, and wheat flour, and edible oil. A good move to try and fix micronutrients that are not available in normal food, and also some minerals. But if you go at different levels and you do test on some of these products, not all, you'll find that they're not meeting the standards. So they need to do surveillance and see, are the food fortified, this flour and edible oil, at a level that is acceptable? Is there something that is missing? We also have cases of aflatoxin that really affects our nutrition. Did we do aflatoxin monitoring? Do we have data? Do we have analysis? And at the county level, do we have labs that people or millers can go and do tests? That they test their product to see they are aflatoxin free. You'll realize that many of these millers have to bring their products to labs in Nairobi. And that takes a lot of time. So what people do, maybe have shortcuts and not to do periodic tests. So the county and the national government has a real responsibility to fix this. And one is budgetary allocation. Number two, as I said, most of the food system transformation is through private sector. SMEs that are in food system, agribusinesses. It's important that we have policies that enhance their capacity and support them in that business so they are able to move the food to whichever location. They are the aggregators. They are the transporters. They are the wholesalers. So we must have policies that really support the business, the private sector, in moving that business to the next level.
If you look at, as you continue, if you look at the current context, what would you term as the challenges for the private sector that act as bottlenecks for them, in being able to make us realize this dream? What would you term unfriendly in the current status of how they do business?
One of the things you've talked to private sector, which apparently we work with. I should have said that as GAIN Kenya, we also in the SUN movement, scaling up nutrition movement, and we co-chair with WFP at the global level, SUN Business, Scaling Up Nutrition Business Network. And therefore, we work with many of these SMEs or many of the small enterprises. The biggest challenge they have is access to finances. Most of them have been categorized as non-bankable. They are not bankable. So they cannot access credit, in many cases, from any institution. Or if they have to access, it is too expensive that it doesn't make business sense. How can we encourage them? How can we support them in a way that they'll be able to have finances to grow their business? And when they grow their businesses, they're able to move the food up to the last mile. As it is now, there's a bit of struggle, and I think we need policies that would really support SMEs in the agribusiness. Is it possible to have something, a grant, or is it possible to have a loan at fair interest rate that would support them to move food to that level? The other thing I would want to say is the capacity. As I said, most of the people go to seek health care at level 2. but we don't have people that are trained in terms of nutrition at level 2. So we need to fix that problem going forward. How do we ensure that people at level 2 have that? The third one, and most important, our production, food production, is not diverse. We are in a country that when we have bumper harvest for maize, we say we are food secure, but we are not nutrition secure.
Yeah.
Because for you to achieve healthier diets, you need diverse food. You need vegetables, you need proteins, you need carbohydrates, you need everything. But we tend to promote staples, and the staple we tend to promote is maize. So once a country has maize, so once we have maize, we sit back and say that we are food secure. Without diversity, you're not going to achieve healthier diets. So we need to see how to diversify our food production. The third and the fourth one is we have an aging farmer population. Our farmers are getting old. The young people are shying away from farming. They would want to come to the city to get white-collar jobs or whatever collar jobs they are. So who is going to produce the food? Yet statistics show that 1 in every 3 Kenyans are now living in urban centers. And by 2030, more than 50% will be living in urban centers. So already they are also seeing a crisis. Who is going to be the farmer? So unless we start mechanizing our production, our farming system, so that it is not laborious, and therefore we can have a better produce, high-yielding crops, high-yielding, vegetables, it will be very difficult to fix the food and nutrition situation in this country.
Right. I like the depth of how you're looking at where this problem could be emanating from. And you've touched on the issue of urbanization, and that is where I wanted us to also talk about, because it's one of the things that inform our consumption patterns. If you look at how things happen, the consumption patterns in our country, studies have shown, are informed by urbanization, things like economic growth, things like the change of lifestyle, whereby nowadays you find us preferring the so-called fast foods, things that are too salty, sugary, sweet on the tongue. But then this actually has a very great consequence on our health. So what can be done to increase the desire for more nutritious foods? What are some of the workable strategies that we can implement to help the population begin to desire and even want to access nutritious foods?
Okay, it's true. We've seen a lot of move towards food that is high in sugar, salts, over processed food. I'm not saying processed food is bad, but over processed food. And young people and even other people, even the older people, tend to go for that food. It's easy, it's fixed already.
Sometimes cheap.
Fast. You don't waste time trying to prepare this food at home. It's easy. You just go and have your food and eat and sleep. And it has health consequences. So ideally, one of the things that we are encouraging now is to have, you have label on the pack so that you see the nutritional, content of that food that you're eating. We don't have that backpack information that consumer can read and see what is the content of the food that I'm eating. How much oil does it have? How much sugar does it have? Those are some of the policy things that we are trying to push with the Ministry of Health, that can we have a label at the back of every food showing a consumer, consumer information. How much sugar am I consuming in this food? It is missing in most of the food. You buy and you don't know how much sugar or salt or oil you're consuming in this
But do you
food.
think if it was labeled, we would even have time to read?
Some people would. Some people would, yes. Maybe not all. But then the other thing is sensitization. Making people aware on the health risk of some of the things they're eating. So as again, we're doing a lot of sensitization now. And we've taken a brand called the Food Fiti brand to sensitize consumers on the importance of eating, on consuming vegetables. So it is important to create consumer awareness on what they are eating. It is done all over the world. If you go to any country outside, Africa, in Europe, yes, the labeling is there, and consumers read. And once with awareness, they know that I need to stay healthy. I need to eat food that is right. So it doesn't mean that food that doesn't have a lot of oil or salt is not tasty. Some of them are very tasty, except we are more or less conditions to think that they're the most tasty and easy and nice food, but they have health consequences. So really a lot still needs to be done to do consumer awareness, consumer education on what is a healthy diet. What are the consequences of eating a healthy diet, particularly in this era that we've seen high rise in levels of cancer and other non-communicable diseases. So it is a very important conversation that we should have with consumers.
Indeed. If you look at how much is spent to treat the lifestyle diseases and even responding to issues of malnutrition, you were talking earlier of 374 billion shillings, then you will find this conversation important. You will see why it's important for us to avert, such a scenario, which is just not a financial crisis, but a health crisis as well. Your body takes a toll, and your pockets also take, bears the burden of...
and an economic crisis.
It is an economic crisis.
When you have a child that was undernourished and was wasted or stunted from the word go when they're young, below 5 years, definitely they're not going to be as productive to the economy, to this country. They're not going to be as productive as like a healthy child. So it has an impact on the economy as well. You'd wonder why sometimes you have colleagues or workers that are slow to understand things, slow to do things. One of the reasons could be that they were young, they were malnourished, and therefore their development has not been as per the level that it should be. So it has an impact on the economy, and it's something that people sometimes do not look beyond just the child now, but looking into the future. How will it affect the country?
If you look at that comprehensive impact, then you get to realize why we all need to be part of this, initiative for just ensuring that every person accesses nutritious foods in the country. You talked about the Food Fiti initiative, and one of the biggest things that you are strongly advocating for as the Global Alliance for Improved Nutrition is, increased vegetable production. I want to understand the genesis of this objective and how is it coming along? What is it that you're doing exactly to make it practical on the ground? Because it's one thing to say, but it's another to actually see people being part of the production of vegetable in the country. So what are you doing?
Thanks so much, Sarafin. It's a lot that we're doing under the Food Fiti brand. And we did a study, feasibility study as Global Alliance for Improved Nutrition, because we realized, and this is from a study by WHO, that showed that a majority of Kenyans don't eat vegetables. Only 5.2% of Kenyan adults eat the required amount of vegetables 5%. And fruits. Yes, 5.2.
That's a drop in the ocean.
Exactly. So, it is recommended that an adult should eat at least 400 grams of vegetables and fruits per day. We are stagnating between 100 and 110 per day as adults, And, one thing Kenyans believe that, you only eat vegetables when you're broke. It's a food for the poor. On a skuma wiki. You eat skuma the weekend. When you get money, you're going to buy animal source protein.
Yeah.
Not a bad thing, but there should be a balance. So we realized that Kenyans are not consuming enough vegetables. And when we went further to find out, why are you not consuming enough vegetables? And there's certain things that consumers talk to us about. One was availability. They want it closer to them. Some consumers felt that they have to move a distance to have the vegetables. Number two was the safety of the vegetable and the hygiene. And particularly in Nairobi, most respondents were, most of these vegetables are grown in sewer lines. So with all the metals, the lead and the other, they did feel safe to eat vegetables. And then number three was the fact of palatability. Vegetable doesn't taste nice.
Yeah, it's boring.
So it's boring. And for children, I don't know, it's not something.
Or bitter. Bitter herbs.
Yes, but if you take the traditional ones. So out of that, we had to find a way of addressing all these consumer concerns. Try and increase palatability, make it more palatable, look at the safety and hygiene of the vegetables, make it accessible, and make it available for the consumer. And then we said, how can we do this best? And we came up with a model, a brand, because we know that brands sometimes sell better. The Food Fiti brand, loosely translated to mean fit food that is fit for consumption. Yeah. So in the Food Fiti brand, we work with the mama mboga or baba mboga. There are also baba mbogas now. Yes. So we work with them to ensure that the food is safe, the environment is clean, and there's hygiene. And we go beyond that and ensure that these vegetables that they say they are not so sure the vegetable is safe. So we work with different organizations, KEFIS being one of them, to do residual tests on the vegetables at the farm level to see do they have the recommended levels of residues that they should have. And if that is not the case, then we connect them, we work with the county agricultural officers to work with the farmers to support them in knowing when do you spray, how much chemical do you need, which chemical do you need to spray your vegetable, so they meet the required level of KS 1758. That is one. Number two, we also train the county agricultural officers on good agricultural practices, which now they train the farmers on, so that we now have what we call the market facilitators that source vegetables from those approved suppliers that are being tested, that are being trained, and therefore they are safe. These market facilitators are the ones that will sell to the mama mbogas and to the baba mbogas. So the issue of safety we are trying to address. It's sometimes a challenge. You'll find somebody has sourced vegetable from another source, but we are moving, making it wide and see that this vegetable is tested and is safe, and we do periodic tests. Whatever results we get, we go to the county authorities, county agriculture officers, say, look, these farmers need some support so that they don't overspray or use chemicals that are not approved.
So it's not just about ensuring access and availability, it's also about looking at the quality standards and whether it meets the threshold.
Exactly. And we're using the government-approved quality standards. After that, then we come to the mama mboga, train them on hygiene, train them on food safety, train them on business skills, because it's a business for them, they have to make some money. And then do recipes, vegetable recipes. How do we make it palatable? How do I make a sukuma wiki samosa? You should come and see one of those demonstrations when we have a sukuma wiki samosa, and everybody loves it. How then do we train mama mboga and the client on the different recipes that we've contracted chefs in this country to develop? And to also, attach some finances to it. If I want to make a meal of sukuma wiki for 5 people, how much would it cost me? How do I make it more palatable? How do I make managu more palatable? So all that we are doing so that there's increased consumption of vegetables. Again, we also have ingredients vegetables and flavored vegetables, which we are encouraging people to use because they make the food more palatable. They make the food more tasty. So a whole range of things that as a Global Alliance we are doing in the space of increasing the consumption of vegetables in this country. We are using Food Fiti brand now to push the vegetable consumption, but it is a brand we'll use for other food groups, like the animal source proteins. It's a brand that we'll use for the animal source proteins and others, but we've started with vegetables. We are hoping that by the time we finish, at least 7 million Kenyans should be able to make vegetables part of their meal every day. And this is by 2026. And then see how do we scale up this intervention to cover all Kenyans.
Nice. This is in like 2 years.
Yes, this is like in 2 years.
So far, how do you gauge the success or the impact since you started this initiative? What can you say have been your milestones?
Yeah, one of the things I say that we've seen increased diversity in purchase of vegetables from the mama mbogas. They are now stocking diverse vegetables. Before you'd find a mama mboga stocking or maybe sukuma wiki and spinach, but now we see the managus, the amaranth and others being stocked, and they say there's increased purchase and there's increased consumption. Consumers are now demanding for a variety of vegetables. We've also seen other people wanting to participate in the program and saying that I want to be a mama mboga or I want to be a market facilitator, or I want to learn more about your recipes. And we've organized for groups recipe demonstrations at the community level, community social halls, churches, mosques, so that people can know how best do I make vegetable. Because if food is not palatable, even for me, I will not take it. So we have to make it palatable. We have to make it desirable. Even the presentation of food alone makes it exciting and sexy. Yeah. So we work on all that. And we've worked with chefs to help us manage and see how do we improve consumption based on those lines.
All right. So I want us to look at, I know you've touched on quite a bit, but let's go deeper into this conversation and look at some of the broad-based strategies that you think, if implemented, can help us as a country to address the nutritional gaps that we still face. What other strategies do you think we can?
One, we need a very well-coordinated multi-sectoral approach to nutritional issues. As I said, we are working in silos. We have the Minister of Education doing good work in school feeding, Minister of Health looking at the emergency therapeutic feeding and all that, agriculture trying to do production. But where is the convergence? Who brings all these people together to know that we are achieving good nutrition? So we need a very well-coordinated system, a multi-sectoral approach. Number two, we need to budget for nutrition. We need to see that there's investment in nutritional activities. And recently, we are working with some organization to really monitor how much people put in nutrition. So the study will be out soon, and I hope we'll be able to share with all Kenyans to see what is the investment in nutrition from national to county level. Number three, we need to really do mandatory fortification of staples. We are currently doing maize flour, wheat flour, and edible oils. Can we bring other vehicles, fortification vehicles like rice? Because they really help us get the micronutrients that are missing in these foods, like iron, calcium, zinc, and other things. So we really need to move and monitor, do a lot of surveillance on the fortifications that we are already doing in the country. Do they meet the required standards? I know we are going in the second phase of the fortification strategy, but key is monitoring, particularly at the county levels where a lot of activity is taking place. Number three, we also recognize that we cannot fortify all the food. Why don't we look at biofortification of certain crops? As again, we've started by fortifying iron beans, working with Angaza and Nyota, and the results are enormous. These are beans that are very high in iron content and very good for pregnant women and even adolescents. So how can we increase the number of biofortified crops in the country? And the fourth one, can we increase investment for the private sector to be able to move the food? They are actually in the value chain. How can we support the private sector who are in the value chain? Number five, we need a lot of sensitization and education on matters nutrition at the community level, at the school level, at every level, so that communities are aware on the food they need to eat, how they need to eat it, and the frequency, and even the amount that they need to eat on a daily basis. Yes.
So somebody could be watching and they're asking, okay, you've spoken about the county government, the national government, but then again, what about me in my small corner of the world? How can I, influence my space or my society or my community so that the entire country, we ensure that we have sort of like what you'd say boots on the ground that are fighting for all of us to be able to access nutritious food. So how can the viewer, also do something, and what can they do?
Yeah. So thank you. For the viewers, I think it's important to eat a balanced diet, variety.
So you start with self.
You start with yourself. Okay. I know Kenyans have this say that if you don't eat ugali, you've not eaten food.
But isn't it true? Demystify the myth today.
Ugali is good. It's a carbohydrate, but we have several of them that somebody can eat to still get that. But then you can't eat ugali alone. You need carbohydrates, you need proteins, you need vegetables. That balance and that diversity is what is important. You need to diversify. Even vegetables. You cannot eat sukuma wiki every day or cabbage. You need to go to the green leafy vegetables. There are also ingredient vegetables. We also have flavored vegetables. All this makes a difference. We have the animal source proteins. We have the other proteins that are coming from crops. We need to diversify our diet and do it on a daily basis. You don't have to be rich to have a diversified diet, but you need to pick small things here and there to make a balanced diet. Particularly the farming community, everything that is in the farm really contributes to a balanced diet. We have a tendency, particularly for farmers, to produce so much and sell everything. And at the end of the day, you have nothing for your family. Let's keep fast. Let's produce fast for our families before we go out to sell. Thank you.
And I'll add there, let's produce fast for our country.
Yes.
Before we go out there to the globe to sell. So we do not have to export everything. Yeah. Before we wind up though, counties like Turkana, Marsabit, if you look at Garissa, Wajir, Mandera, they are ranked as the ones that are leading in the burden of malnutrition in the country. If you look at reports and studies, something that cuts across and a pattern that is quite common is that those counties actually have the burden of malnutrition. In terms of the strategies, what do you think can be done that is contextualized to the unique challenges that these counties face, things that would work to the populations in those areas, because it has become a perennial problem?
Yeah, thank you very much for that question. Yeah, let me also demystify that not all counties in the ASAL have issues with malnutrition. You know, we have a classical case. If you look at KDHS 2022, I think Garissa, if I'm not wrong, is not having high rates of stunting. What is Garissa doing that other countries are not doing? So we need to have classical cases, you know, for study. What are they doing? But overall, I would say that we have counties that have excess in production. If you look at the Western counties, they have excess. And why don't we have a supply chain that would move food from Western to the areas that have less? And you know, what brings all these issues makes the food more expensive when it reaches us. Why don't we work on this? It usually says at every toll gate, each county wants to charge a cess. And by the time the food reaches the consumer bears all the cost of the cess from Bungoma all the way to Turkana. So how do we harmonize cess in this country so that there's only one point of cess, and therefore the food reaches the consumer there? And is able to be affordable. Because it is not affordable, people are not going to ask for food to come from that side. Number two, how do you work on our transportation to reduce food loss? Can we have cold chains for transportation? Can we have cold storage in those locations? We've done that as GAIN. We've done that in Marsabit. We've done that in Isiolo. And third, these communities also produce certain foods. There's sometimes a lot of milk in these communities, but there is no storage. There's no way of storing this milk, of processing this milk, so that we elongate the shelf life. So all those things can be done. There is meat production in this location. How do we support them to process the meat so that they can have a longer shelf life, and they can also export the meat and use the money to buy other foods that they need? So we are always looking and thinking that there is nothing in these communities. There's absolutely so much in these communities that needs to be harnessed, and they need to be supported to be able to produce it and to be able to manage it well. It is of extreme weather conditions that sometimes when they produce, it doesn't last even a day, even a few hours, and the food goes bad. We've worked to ensure that we can elongate the shelf life, we can help them harmonize the milk they produce, and even move it to the last mile, from the centers to the interior, by having cold chain motorcycles that move milk to the communities. So it's more of a strategy. But again, also looking at production. There are dams that a government is building in these locations. Yeah. They should be productive dams. They should be used for irrigation. We don't have to depend on rain-fed agriculture throughout. Yeah. There are countries in the world that never see any drop of rainfall, but we import food from them. So I think we also need to move away from depending on rain-fed agriculture and start using irrigation and other technologies to do production.
Yeah, especially considering the realities of the weather patterns that are increasingly becoming unpredictable. Israel has become a classic example. Yeah, of
Egypt.
Yes. Egypt, yeah.
Yes.
I want us to look at the final, what would you term as your pressing clarion call. You've talked to us about the burden and the problem where it is and what what can be done.
Yeah.
As we close this conversation, what would be your pressing clarion call on what needs to be done urgently for us to save the lives of these children we are talking about, and even adults that are currently, facing malnutrition?
Yeah. Thanks, Sarfine. I think my clarion call will be, let's invest in nutrition. Let it not be an add-on to what we're doing, but let's put aside a budget for nutrition and nutrition activities. Let us look at the whole scope of food system transformation and not looking at the end when there's a nutrition emergency and coming to address. If we look at the whole spectrum, from production to transportation to storage to food loss and food waste, then we are able to address the issue. So my call really would be to government, let's have a budget for nutrition. And to the other stakeholders, I believe that there's so much we can do to support the private sector, who are actually important players in the ecosystem of food system transformation. And finally, at the community level, we need to sensitize communities on what is right nutrition and what they need to do to have proper meals and proper diets.
All right.
Yeah, and at the global level, we've made several global commitments. Can we honor them? If Kenya put 10% of their budget in agriculture, I think it would be enormous, and we'll see the difference as per the Malabo Declaration. We say that we'll end hunger by 2025, about a couple of months away. We are seeing increasing food insecurity. If you look at the Bill and Melinda Gates report released yesterday, the global hunger situation is not getting better, and issues of child malnutrition is getting worse. So did we make declarations that we know we were not able to commit to? We are going into the Kampala Declaration next year, I think in in January or February. Let us be really committed to these global declarations that we make, because they affect us as a country as well. And we have the capacity as a country to do that. Yeah, thank you.
All right. Yeah. Thank you so much. Looking forward to having this conversation with you again, just to catch up on, the progress that, you are making in this initiative. You've started with vegetables. Looking forward to also seeing this cascade to other types of foods, to be able to ensure that we have populace that is healthier and is eating better and living a better lifestyle. I've been having this conversation with Ruth Okoa. She is the country director for the Global Alliance for Improved Nutrition right here in Kenya, as we are talking about the state of nutrition in our country. Now you have a role to play. As you wait on your county government or the national government, there is something you can do in that small space next to your kitchen or behind your house, at your backyard, at the farm there. There's something you can do to ensure that your family first is healthy. And then if we have healthy families, we have healthy communities, and we have a healthy nation. Thank you so much for watching Daybreak this morning. That has been Health and Lifestyle. My name is Safina Chengoma. I really appreciate your time. Enjoy the rest of your day.